There were 1,533 locally acquired cases reported to 8 o'clock last night in New South Wales, and 1 overseas acquired case for the same period. And there were 131 tests before 131,174 tests reported to 8 o'clock last night, compared to the previous day of over 150,000. Sadly, as the Minister mentioned, there's been 4 deaths reported in that same period, and our sympathies and condolences go out to the families and friends of those people who died. We have had a number of areas of concern identified through both where our highest numbers of cases are occurring and also through positive sewage detections based on our ongoing sewage surveillance system for virus fragments. So we've seen fragments of the virus that causes COVID in several communities where we don't have known cases. And so we're really stressing that it's so important for people living in those communities to come forward for testing with even the mildest of symptoms. So those communities where we've detected fragments of the virus include Tamworth, Glen Innes and Port Stephens in the Hunter, New England area, Cooma in southern New South Wales, and Kempsey on the mid-north coast. So if you live in one of those communities, please be very aware to watch out for symptoms and get tested at even the mildest of symptoms. We've got a number of the highest rates of disease, so the highest numbers of disease in the Sydney metropolitan area continue to be in the west and southwest of Sydney, where we've seen over 80% of cases occurring in those areas. So we're particularly concerned about the suburbs of Guildford, Auburn, Merrylands, Greenacre, Liverpool, Punchbowl, Bankstown and the surrounding areas. It's notable that of all our cases, almost 70% are aged under 40 years of age. So this disease is largely affecting younger people. Younger people are particularly concerned because they both are exposed to their kids and expose their kids, but also their parents and older relatives who are quite vulnerable to disease. So it's really important that if you're particularly in younger age groups, please come forward for testing at one of the many convenient sites. Thank you very much.
Thank you, Brad, and Jeremy, thanks for the opportunity to speak today on behalf of Lifeline, and particularly about what's happening with respect to mental health for so many people in New South Wales and Australia. The first thing I want to say is in recent weeks we've heard a lot of people talk about a shadow pandemic in mental health. I think it's important to realise it's not in the shadows, it's real and it is a crisis. The crisis is extending to all parts of Australia, all parts of New South Wales and to many, many people. What we have seen is a significant increase amongst children and adolescents in their mental health illness, in their suicidality and in stress and depression and anxiety.